Panic attacks are one of the most common mental health issues that people experience. The effects can be frightening, but there are steps that you can take right now to help reduce anxiety and manage your symptoms. News 4's Anyang is working for your health with that story.
There are effective, evidence-based techniques that can help stop the spiral quickly and reduce the frequency over time without medication. Psychiatrist Dr. Johusa Weiner joins us today to walk us through some of these strategies. Thanks for joining us. So, Dr. Weiner, we all feel a certain amount of stress, but what exactly is a panic attack and how does it present?
First off, panic attacks, there's about a 1 in 3 chance that somebody in their lifetime will experience a panic attack. So these are incredibly common. So you have 2 parts to your nervous system: sympathetic, which is the fight or flight; parasympathetic, which is the rest and digest. Normally you want it to be like a seesaw and you want it to be in balance. Then you're kind of in a calm state. Well, when you're having a panic attack, that fight or flight sympathetic nervous system goes on overdrive. And then you get this flood of physical symptoms. Heart starts pounding, shortness of breath, break into a sweat. It is really frightening for a lot of people, and it leads a ton of people to think that they're dying or having a heart attack.
So what are some common or immediate techniques to manage a panic attack in the moment that don't require medication?
Slowing your breath is what stimulates your parasympathetic nervous system. So there are many ways to do this. There's something called box breathing: 4 seconds in, 4 seconds hold, 4 seconds out, 4 seconds hold. There's another one where it's called 4-7-8. 4 seconds in, 7-second hold, 8 seconds out. There's another thing called cyclic or physiological sighing. I could talk about that one as well later, but these are all ways to essentially slow that breathing down, activate that parasympathetic nervous system, which then helps bring things into balance.
So we know focused breathing can really be an effective tool in so many occasions. I've tried the box breathing. You mentioned also something called cyclic or physiological sigh. Can you explain more about that?
Sure. So this is just a pretty simple technique, and probably the data supports this more than any of the breathing techniques. So essentially what you're doing is you're doing a double breath through your nose and then a long exhale. So it looks like this. That's it. Pretty simple. You're trying to do that multiple times, about 5 times over the course of several minutes, and that immediately activates that parasympathetic nerve, calming people down.
So how quickly do these techniques work? Should people expect to notice improvements in their symptoms soon?
Generally, panic attacks, actually, they don't really last that long anyway. So one of the main things is just recognizing, okay, this is temporary, this is going to pass. Try to do that slow breathing. Generally, a panic attack's going to last 5 minutes, 10 minutes. Maybe if you're really in bad shape, it might last 15 or 20 minutes. But when you do these breathing exercises, generally within somewhere to a minute or 2 minutes, you're going to start to feel your body calming down, and all those physical symptoms that are making you afraid that something really terrible is going on with your body, those are all going to calm down. So you got to give it a few minutes. You can't just do these breaths a few times and think you're going to be all better.
Breathing, practicing that deep breath is probably helpful for a lot of situations in life, and especially if you're having a panic attack. Dr. Johusa Weiner, thanks so much for joining us with that important information.
My pleasure.